If you've been battling melasma or stubborn dark spots and nothing's worked, then kojic acid is worth trying. But don't just slap it on your skin, there's a right way and a wrong way to apply it. Welcome to my channel, I'm Dr. Savannah, a GP specialising in skin and aesthetics. This video is part of my new series where I dive into individual ingredients that target melasma and hyperpigmentation treatment. If you haven't already, take a look at my overview video on melasma and pigmentation. It goes through the best products to use. I'll link it in the description and in the comments below. That video lays the foundation, and now we're zooming in on one key ingredient at a time, starting with kojic acid. So what is kojic acid? Kojic acid is a naturally derived compound, originally found in fungi during the fermentation of sake. It's considered a tyrosinase inhibitor. That means it blocks the enzyme tyrosinase, which is essential in the production of melanin, the pigment that gives our skin its colour. So when you reduce tyrosinase activity, you reduce melanin production, and over time that leads to lightening of pigmentation spots. Kojic acid is particularly effective for treating melasma, post-inflammatory hyperpigmentation, especially after acne, and also it's great at treating sunspots or age spots. In many topical products, it's used at 1 to 2% concentrations. You'll often see it combined with other pigment-reducing ingredients like azelaic acid, arbutin, glycolic acid, or vitamin C. This combination approach is usually more effective than using kojic acid alone. Because kojic acid blocks melanin production at the source, it's more of a preventative and gradual fading agent and not an overnight fix. Start by using kojic acid once a day, every day, and ideally at night. This allows your skin to gradually adapt to the product. It's essential to always use SPF during the day. And with any active product, avoid layering it with too many strong actives at once. Because if you're trying to prevent hyperpigmentation, the last thing you want to do is cause irritation, and then this results in post-inflammatory hyperpigmentation. Stick to lower concentrations, especially if you're prone to irritation, and gradually increase the percentage of the product if you can tolerate it and if you need it. Kojic acid is generally well tolerated, but like many actives, it can cause redness, irritation, sensitivity, and rarely it can cause what we call contact dermatitis, where it causes redness, inflammation, and dryness as a result of an allergic type reaction to the product. If you have eczema, barrier damage, or even sensitive skin, it's best to do a patch test and avoid using it with other exfoliants. Because kojic acid reduces pigment, overuse can cause hyperpigmentation. This is loss of pigment. This then results in lighter or white patches, especially in deeper skin tones. So it needs to be used with caution, which is why I recommend using it for 8 to 12 weeks and then taking a 3-month break. I often recommend kojic acid for patients who are on their hydroquinone break, if they've got early melasma where they don't want a prescription product, or to use it as a maintenance treatment after an in-clinic procedure like peels, laser, or microneedling. You'll get the best results when paired with daily sunscreen, gentle skin barrier support skincare routine, and possibly with oral tranexamic acid, obviously under medical supervision. Here are my top 3 over-the-counter products. Number 1 is the Melano CC Intensive Anti-Spot Essence. This Japanese serum combines kojic acid, a vitamin C derivative, and vitamin E. This makes it a powerful combination for targeting hyperpigmentation. It reduces oxidative stress on the skin and also helps to manage uneven skin tone. It's really well tolerated and isn't really irritating on the skin. You apply it once a day at night after cleansing and before using a moisturizer. It's a great product for early pigment spots, acne scars, and for dull skin. And as always, use SPF in the morning. The reason why this product works so well is that the kojic acid inhibits tyrosinase, so preventing melanin formation. The vitamin C derivative is great at skin brightening, and vitamin E enhances antioxidant protection. A study in the Dermatologic Surgery 2003 paper showed that combining vitamin C with other melanin-suppressing agents like kojic acid can actually enhance pigment reduction. So this product has the perfect combination. Number 2, Skinceuticals Discoloration Defense. This product contains 1% kojic acid, 3% tranexamic acid, and 5% niacinamide. The serum is really well tolerated and targets melasma and post-inflammatory hyperpigmentation. You need to apply it twice a day on clean skin, and it can be layered with other products like vitamin C in the morning and retinol at night. It's suitable for most skin tones and most skin types. The kojic acid and tranexamic acid in this product obviously reduces pigmentation, and the niacinamide is a great anti-inflammatory, and it's also great for managing acne. Number 3 is the Murad Rapid Dark Spot Correcting Serum. So this product combines kojic acid, rescorsenol, niacinamide and glycolic acid. So it's a powerful multitasking product that treats both surface level and deeper pigments. This product is used once a day, just at night time, and I'd normally recommend starting off using it 2 to 3 times a week to let your skin get used to it. So this product works really well because obviously you've got the kojic acid that reduces pigmentation, you've got the niacinamide which helps to reduce inflammation and can help prevent acne, and the glycolic acid exfoliates to enhance penetration of your active products. So if you're struggling with pigmentation and not sure where to start, then kojic acid might be worth trying. But as with every skincare product, it's not one size fits all. Always choose formulations backed by science and start slowly. Let me know in the comments below if you've tried kojic acid and how you found it. Thanks for watching.